Let's talk about fats first, and especially seed oils, because they have become very controversial topic. Can you please explain to us why exactly are seed oils harmful to our health?
So there's three things that really stand out that we need to talk about in no particular order. So one of them is the omega-6 content. One of them is something called oxidation products or oxidation stress. And the third is called phytosterols. And I guess there's a fourth element here, which is that seed oils actually also impact on your blood glucose levels. And we'll talk about how they do that. So this, as you know, this is a huge topic. So first of all, a bit of a mea culpa. So I previously have criticised seed oils solely on the basis of their omega-6 content. Then when I learnt a bit more, then I criticised them largely on the basis of their oxidative stress, the oxidation products they contained. However, more recently, it seems fairly clear that there's another element to their toxicity which is probably even more important than the first two, and that's due to them containing in relatively large amounts a plant cholesterol analogue. So it's a plant cholesterol, we call it phytosterol, and it's like human cholesterol but not exactly. It's close enough to human cholesterol that it can be absorbed into our body and taken up into our cells, but it's different enough that it doesn't work the same, and that leads to some toxic side effects. So let's talk about this whole notion of omega-3 and omega-6, and I might just take you on my journey of why I thought the omega-6 fats were so bad. And this is the very first, the most common mistake that, ironically, I've criticised a lot of other people for making. It's mistaking correlation for causation. I think this is clear proof that I fell for exactly the same trick. You see, we've got some research that looks at levels, we call it the omega-3 to 6 ratio. So omega-3 is the type of fat that you largely get from fish oil, for example. Omega-6 we get from seed oils, largely, but that's a simplification. Number one, they're both essential fats, so if you don't have them, you'll get very sick. So they're both equally essential. You don't need more 6 than 3 or 3 than 6 or what. They're necessary. Now, there's something called the omega-3 to 6 ratio. So we know that the ratio you consume in your diet will be reflected in the levels of fat in the red blood cells. And we can do a test and we can look at the ratio of 6 to 3 in your red blood cells, and that will, tell us about the kind of foods you're eating. We also know that when we look at the omega-3 to 6 ratio, that it is hugely predictive of all sorts of ill health, your risk of having a cardiac arrhythmia, your risk of dying from a heart attack, so on and so forth. We understand, and we're talking like a factor of 10. So people with the best ratios might have 10 times less risk of heart attack, than people with the worst ratios. So hugely compelling. However, it is only associational, and that's a mistake I made. I looked at this and I thought, well, clearly people with more omega-3 are doing better when we look at this population-based data. I'm going to discourage my patients from having omega-6, and I'm going to encourage them to have omega-3 rich foods. Now, incidentally, that's actually the right thing to do. Unfortunately, I didn't end up giving my patients bad advice based on this, but I truly believe that it was the omega-6 which was actually toxic. And then later on, there was a study that looked at people on low-carb diets and low seed oil diets, and that actually found that people's level of arachidonic acid, which comes from omega-6, actually increased on low-carb diets. And it's like, how can that be? We've assumed that omega-6 is bad because it produces arachidonic acid, and arachidonic acid leads to inflammation. So it just didn't make sense how arachidonic acid levels could increase on this low-carb diet. Now, the reason is because the omega-6 and the arachidonic acid is not inherently inflammatory by itself. It needs an inflammatory trigger. And only when it's had that inflammatory trigger will it produce these nasty downstream chemicals like leukotriene and so on and so forth. So if you're in a low inflammatory state, if your body doesn't have these inflammatory triggers, the arachidonic acid will just sit there, and it won't cause you burning or pain or swelling or what have you. And that also explains why the arachidonic acid level might increase on these healthy diets, because you've actually got less inflammatory triggers, so the arachidonic acid isn't turning into these inflammatory components, it's just sitting there and accumulating. So that was the very first visibility. I thought maybe I need to reevaluate my thought process that omega-6 fats are inherently inflammatory, because this study speaks very much against it. And I was also, about this time, I was developing some visibility about the harms of what we call oxidation. So when we say oxidation, when a piece of metal is in the rain and it rusts, that's what we call oxidation. That's oxidation stress. From a chemical perspective, it's what happens if you've got an electron orbital with a valence shell and you take away an electron out of that. That's what oxidative stress is. But this also happens in the body to our molecules. So our bodies are constantly defending themselves against oxidation. It's just unfortunate that our bodies survive on oxygen. So there's inherently, by design, we actually need to defend ourselves against this level of oxidative stress. And we know that seed oils, because of their bonds, these what we call the polyunsaturated bonds, which is you have two carbon atoms and they've got two bonds between them. They're very, very reactive, and they can oxidize easily. Now, the problem with these oxidation products is that we can consume them. So you have vegetable oil, that's oxidized in the bottle. You consume it, it gets taken up, it enters your bloodstream. And it does all sorts of things. You would have heard of small dense LDL, which is the damaged LDL. Well, one of the ways to damage it is with oxidation. So consuming seed oils with all their oxidation products is not necessarily a good thing. We've actually done studies where we get people to drink an oxidized oil, and in an average person, we can see it in their blood for 8 hours after they consume it. But here's the thing, what happens if you're a diabetic with poor sugars? Then we could actually detect it for 9 times longer, up to 72 hours or 3 days in the blood. So this oxidation component of seed oils is absolutely a part of the reason why they're deleterious, and far more significant than just their content, they contain omega-6 fats. Well, omega-6 fat is not inherently inflammatory, it's actually an essential fat. Without it, you'd get very sick. But then there was a third element, and I first got awareness of this. There's a condition called phytosterolemia, and this is a condition where people absorb a plant analog cholesterol called phytosterols. And one of those phytosterols is called cytosterol. That's why we call it phytosterolemia. Now, normally, our body can understand that this cholesterol, this fake plant cholesterol, is toxic, and it rejects most of it. It still ends up absorbing maybe 0.5 or 1% of it, but most of it gets rejected. But people with this condition, cytosterolemia, they absorb large amounts. They might even absorb 15% or even more of what comes in, and that gets incorporated into their cells. And people with this condition, cytosterolemia, they are known to have severe premature atherosclerosis. There's even cases of children as young as 5 years old being diagnosed with heart disease with this condition. So clearly, these plant sterols or phytosterols are toxic for us. They cause problems. And when they've done biopsies on atherosclerotic plaques, they're saying, well, this is a clogged artery. We do a bypass graft, we cut out we'll bypass it with a vein, but let's just take a sample of this one. And when they've done that and they've looked at it under microscopes, they've actually found that these phytosterols are actually embedded within the atherosclerotic plaque. So there's a lot of lines of evidence that will indicate, and I've got lectures on this online, about how these phytosterols can be toxic. And it's my current belief that the deleterious effects of seed oils largely come from these phytosterols, with a significant contribution from the oxidation. But the omega-6 content in and of itself I don't believe is that much of a problem.